to Empowered PT with Dr. E. Today I'm going to take you through a couple of non-weight bearing exercises that can be effective in strengthening your knee. So whether you have knee osteoarthritis or patellofemoral pain syndrome, or you just have weakness following a surgery, these exercises are really safe and effective at strengthening the muscles in the hips and surrounding the knee. So just keep in mind, if you aren't able to get down on the floor, you are able to do these exercises from your bed. And I always recommend just start with the amount of repetitions that you can do until you feel like you fatigue. So that might be 10 repetitions to start, it might be 20 or 30. But you want to stop when you start to feel that fatigue, and then each time you do this routine, you can add on more repetitions, ideally working up to 3 sets of 10 for each exercise. You can also advance these exercises by utilizing an ankle weight or a resistance loop to make them more challenging. Okay, so let's get started. So the first exercise I'm going to show you is a straight leg raise. So to begin, you're going to lie down on your back with one knee bent and the opposite leg straight. You're going to flex the toes toward you, and then you're going to press the knee down toward the mat, and you're going to lift the leg up just to the height of the other knee, hold a second or two, and then slowly control the descent. So you want to focus on every time before you lift that leg, you're tightening the muscle by pressing the knee down, lifting up nice and slow to the height of the knee, and then slowly controlling the lowering aspect. Now, you should feel this exercise in the quadricep on the top of the thigh here. What you don't want to do is you don't want to use momentum like this. Okay, so slow and controlled and forcing that activation of the muscle is going to strengthen it much more effectively than utilizing momentum. Okay, so you can start with the straight leg raise here. If this just feels way too easy, then feel free to put the ankle weight on either your ankle or above the knee. If you feel any stress in the knee with the weight on the ankle, you can just shift the weight up closer to the knee joint, and that'll take some of the stress off the knee. Okay, so then we would switch and do this. We always want to do these on both sides, flexing the toes toward you to make sure that knee is straight, lifting up to the height of the knee, slow, controlled, lower, back down. Okay, so starting with either 10 or 15 or 20, whatever feels challenging to you. Okay, so that is the straight leg raise. The next one is the side lying hip abduction. So you can lie on your side. You can either support your head with your arm like this. You can use a pillow or support it on the arm in a neutral position, whatever feels good. But your bottom knee is going to bend up toward your chest. Your top leg is going to stay straight so that your hip bone is facing forward. You don't want to open up the hip so you're rotating back. But I do want you to bring that leg back slightly. So it's at about a 45-degree angle kind of behind the hip bone here. And then you're going to flex the toes, belly button stays in, and you're going to lift the leg up and slowly lower down. So by bringing that leg slightly behind you, you're really isolating the gluteus medius muscle here. If we lift the leg in the plane of the hip, then we're working a little bit more of the TFL muscle, and even slightly in front, we're really getting that TFL. But most of the weakness in most of us is in that gluteus medius. So we're going to bring it at that 45-degree angle, slightly behind the hip, flex the toes, lift up, hold a second or two, control the descent. So I just want to make sure that you're keeping your belly button pulled in You're keeping the hip bone facing forward so you aren't opening up this way. And we're just going slow and controlled, avoiding any momentum. Now, if this feels too easy, then feel free to utilize the ankle weight, or you can even put the resistance band up above the knees, okay? So you would do this one on both sides also. And then we'll move into the clamshell. So for this one, you're gonna bend your knees and you're gonna stack your feet. You're gonna put the top arm down in front of you just to help stabilize. And keeping the feet together, you're gonna lift the top knee up, hold a few seconds, and close it down. So this is working the hip external rotator muscle. So you should feel this like deep in the glute muscle here. So we're gonna open, hold a few seconds, and close, making sure that we aren't rotating that trunk and hip as we lift. And on this one, if it feels too easy, by the time you get to 10 or 15, you can certainly progress it by adding the resistance loop up above the knees. Don't be surprised too if it feels much harder on one side than the other. Depending on how flexible you are, is going to determine how flexible and how strong you are will determine how high you can get the leg. But the most important thing is that you're maintaining good form and we're not rotating back from the trunk. Okay, so that's a clamshell exercise. And then next I'm going to take you through a bridge. So if you don't have a Pilates style squishy ball at home, then you can just take a pillow and fold it in half, but you're going to put it in between the inner thighs. So make sure when you're placing the ball, it's not going between the knee joints. It should go farther down, more between the thighs. So we're going to lie on your back here, and you're going to make sure that your heels are not too close to your butt, okay? We want to walk them farther out because we're going to focus on the hamstring muscle here. So you're going to press the thighs gently into the ball to get the inner thighs working, and then you're going to drive the heels into the ground as you lift your butt up. So you're going to hold for 2 to 3 seconds, tighten your tush as you lift, and then slowly lower it down. So what you do not want to do here is arch your back. We do not want to jerk the motion by stressing that low back. Driving through the heels, pressing into the ball, you should really feel it in the hamstrings, the inner thighs, and the glute muscles. If you're feeling it in your low back, then you're probably lifting too high and not driving through the heels enough. Okay, so don't worry so much about height. Just pay more attention to where you feel the contractions. Good. Just do a couple more. Nice and slow and controlled, pausing at the top, squeezing that tush together. Good. And then the other one I want to show you are to work the hip internal rotators. So for this, you would need a resistance band, and you can determine the strength of the resistance band based on how weak you think you are. You can always start with a lighter band and then progress it if it feels too easy. But you're gonna put this band around your ankles, and then you're gonna turn over onto your belly. Now, if this feels like you have pressure in your back, you can put a pillow underneath of your pelvis as you do this exercise. But what you're gonna do is bend the knees, and you're going to just gently push the legs apart. So the lower legs will pull apart. You're gonna hold it for 3 seconds and then come back in and relax. So pull apart and relax. This is not a big movement, but you should feel it deep in the glutes here. So this is working again, the internal rotators of the hip. And this one you're holding anywhere from 3 to 5 seconds. And you're trying to keep that 90-degree angle, so you don't want the legs to come up too close or be down here. It should be right at 90 degrees. These muscles are small, and so they usually will fatigue faster than some of the larger muscle groups. But these hip rotator muscles are incredibly important in preventing knee injury and making sure that the stress is decreased on that knee joint. So keep in mind, these exercises are not necessarily meant to be done every day. Every other day is plenty. And also keep in mind that strength changes usually occur at 6 to 8 weeks. So after doing these exercises for 3 weeks, you will probably start to feel a difference, but true strength changes usually take 6 to 8 weeks. So be patient with them, keep up with them. Consistency is the key. Thank you so much for joining me today. I hope that you found these exercises helpful, and feel free to check out my website membership at www.empoweredptandwellness.com, where you can find even more in-depth videos. Thanks so much for joining me. Don't forget to like and share this video with your friends and family. Hope to see you soon. Bye-bye.